and welcome to a brand new episode of The Doc Is In. My name is Prudence Marshall, and I'll be your host for today's episode, brought to you by the Oncology Institute here at the Fatima bint Mubarak Center at Cleveland Clinic, Abu Dhabi. Here with me for today's episode is Dr. Ahmad Raza. Dr. Raza is a fellowship-trained and American board-certified specialist in internal medicine, medical oncology, and hematology, and is currently serving as a consultant medical oncologist here with us at the Fatima bint Mubarak Center. With over 20 years of experience, Dr. Raza joins us today on The Doc Is In to discuss his expertise in thoracic solid tumours. Thank you, Dr. Raza, for joining us today on The Doc Is In. It's a pleasure to be here with you.
Thank you.
So before we get into the specifics about the care available here at the Fatima bint Mubarak Center at Cleveland Clinic, Abu Dhabi, could you just give us a brief overview on what lung cancer is?
So lung cancer is quite a common cancer, and it has been the second leading cause of cancer-related deaths worldwide. It probably still is. In the United States, there are close to 400,000 new cases a year. The difficulty with this cancer is that historically, if someone is diagnosed with lung cancer, and their odds of surviving this cancer at 5 years have been just 25%. This field has evolved quite a bit over the course of last few years.
It's good to know that there's been evolution in that area. Building on that, could you talk us through what are the different types of lung cancer within that category, and do they differ in terms of prognosis and treatment?
There are few types which are quite common. Non-small cell lung cancer is the most common type. This is the cancer which is mostly related with smoking. Another type of lung cancer, which is called small cell lung cancer, it is related to smoking as well. So the other risk factors are there. Household radon exposure, which is less well known in this area, I think, but it's quite well known in the Western world, is a risk factor. Exposure to some pollutants and exposure to asbestos, exposure to additional risk factors like radiation and lifestyle, they can factor in terms of risk for lung cancer.
So, are there specific tests that can be done to determine if a patient's diagnosed with lung cancer? How do we know if it's spread?
There is a standard way of assessing the patient once they are diagnosed with the lung cancer. It is usually imaging, which involves PET scan and brain imaging most of the times. And this is how we determine the extent of disease.
Thank you so much for that. Could you share with the audience now, within medical oncology, what are the primary treatment modalities that you would see for the treatment of lung cancer, and are they split into particular categories?
Like any cancer, in general, there are three major modalities. One is surgery, the other is radiation, and the third modality is systemic therapy. Systemic therapy includes all types of treatments, including chemotherapies, targeted therapies, novel biological treatments, and immunotherapies.
You've mentioned immunotherapy. In our discussions, you've mentioned that in recent terms, we've seen the combination of chemotherapy and immunotherapy used as a neoadjuvant treatment for patients before surgery. Could you talk us through a little bit more about that?
The resectable lung cancer, if the disease has spread to the lymph node, risk of recurrence is quite high. Historically, the risk of recurrence was up to 70 to 75% in those patients. Most recently, in last 1 to 2 years, we have seen that data is supporting use of chemotherapy and immunotherapy combinations before the surgery. We have seen very good responses. And on top of that, data is supporting that these patients who are getting chemotherapy and immunotherapy before surgery, their outcomes are better. It has become a new standard of care, and it is a very important new development in treatment of these type of patients.
And that's wonderful here that, again, there's been development in that. When a patient's looking at beginning treatment for lung cancer, could you talk us through any anxieties or concerns that you see commonly expressed that you could address for us today?
So cancer in general is a life-changing diagnosis. It changes the life for the patient and for the family. It is very involved treatment. It is an emotional and psychological emergency initially. Then it has a huge burden in terms of financial burden and also physical disabilities and other difficulties. the patient has to bear that, and then the family has to bear that. So it is treatment for cancer is a teamwork. So we need a team of different doctors, nurses, other specialists, and also we need the support from the social work team as well.
Thank you. It definitely is a multidisciplinary approach to the treatment of lung cancer, and we're very grateful to have that here at the Fatima bint Mubarak Center. Moving on from the treatment, is there any misconceptions that you would like to alleviate for our patients today or help address any concerns that someone may have that's recently received a diagnosis?
There are multiple challenges in terms of diagnosis and treatment for cancer in general. For lung cancer in particular, it has been known that it is related to smoking. So that is the reason in the past it has received less attention because of stigma associated with smoking and the cancer. Nowadays, people who have long history of smoking, there are screening methods available to detect the cancer early. Early detection of lung cancer results in cure in most of the patients. So early detection and screening is very important.
It's a wonderful place to start, and we're very grateful to have some incredible pulmonologists and interventional pulmonologists here that take care of that for us. Moving into the final portion of the podcast, there's something interesting I would like us to discuss today. Over the last 20 years, there's been significant development in something termed tumor molecular profiling. Could you elaborate on that for us today for our audience?
It is a fascinating story. In 2004, first targeted therapy for lung cancer was approved for EGFR mutated patients. That was called erlotinib, and that worked very well in number of patients, and a fraction of the patients had a long-term disease control on that medicine. But that was just the beginning. Over the course of last 5 to 10 years, the next generation of those medicines have evolved, and then we have found new targets. So there are a number of targeted therapies available, and there are a number of new approvals as well. In terms of genomic profiling of the tumor, tumor DNA is sequenced, and we try to look for every possible mutation where a treatment option can become available for the patient. All those approvals are coming in very quickly because the drug development for targeted therapies has evolved quite a bit, and most of those options we have available here.
Given that you've mentioned that they're targeted therapies, could you elaborate a little bit more? Does this particular testing then support medical oncologists such as yourself in recommending or designing an individual treatment plan for that patient?
It must be, I should say, it should be a standard to do genomic profiling of all the cancers, in my opinion. It provides a lot of information in terms of the behavior of the tumor, potential treatments, and it also helps the physician to sequence the treatment in the right way.
Thank you, Dr. Raza. This has been incredibly informative, and I'm so grateful that you've joined us today. And to all of our listeners, if you found today's discussion valuable with our consultant oncology expert, Dr. Ahmad Raza, please feel free to share this podcast with your community. And until next time, take care and stay informed with The Doc Is In at Cleveland Clinic Abu Dhabi.